There's no doubt that incorporating massage therapy in instances of acute and chronic pain is an extremely effective tool to be used. The work that we do doing manual therapy works very well in conjunction with physical therapy, occupational therapy, and even it works with PTSD and psychiatric care as well.
As a massage therapist working in the population living with chronic and high impact pain, collaboration is key to success. Working closely with the pain management specialist, the interventionalist, working with other providers in integrative care from chiropractors, physical therapists, acupuncturists. It is a complete collaborative effort with the goal of helping that patient live with less pain and have a better quality of life.
When I think of incorporating massage therapy in pain settings, either acute or chronic, it truly makes my heart happy. And the reason for that is that when you start integrating massage into care environments, you're actually bringing massage to people who are going to benefit from it most and who most often aren't the people who are going to be able to access it. And so being able to incorporate it in health settings, whether that's in stays or outpatient stays, it brings it to folks who are really going to benefit. And it makes me very happy to hear that there's consideration of it being incorporated.
In my massage therapy clinic, we collaborate a lot with other healthcare providers, and not surprisingly, most specifically with primary care providers, because they are that first line of contact with patients. And because we've been in the community for many years, they know the value of soft tissue and how soft tissue conditions can often mimic more serious conditions. So it's interesting, during the second wave of the pandemic, the state of Illinois actually required a medical referral for massage therapy during that second wave, which was, whoa. Actually, within 2 months, we had 442 referrals at the clinic. That shows you the connection and the value of massage therapy and how it's being perceived by certainly primary care. The other aspect that we tend to work a lot with is physical therapists. When someone sees physical therapy for some sort of musculoskeletal condition, it's often for a certain number of treatments, but at that point when that number runs out and insurance is no longer covering it, there's still work to be done. And we have a really good relationship with physical therapists and work in conjunction with them. And so we have many physical therapists who refer to our clinic, and it's a wonderful symbiotic relationship.
So in our practice, we see a great number of patients living with pain, everything from chronic regional pain syndrome, known as CRPS, Lyme disease, fibromyalgia. We're finding that patients who have had, traumatic events, motor vehicle accidents, and other injuries live with these long-term pain patterns, and massage therapy is very effective in helping to reduce their pain and improve their overall quality of life.
When I was still practicing, I saw a lot of pain experience. I specialized in older adults. And when you're working with older adults, there may be some chronic conditions that pain accompanies it on a regular basis. And it's conditions that aren't going to be cured by a massage. However, the experience of that pain can absolutely be impacted. So whether it's something that is an acute injury, or they're having a fall or had an accident or something like that, you can address the musculoskeletal pieces in that moment to help with that pain relief, or if there's tension or what have you. But in those conditions, whether it's arthritis or other sorts of pieces, being able to help people with that pain experience and that pain management was where I was looking in my practice.
In my practice of massage therapy, it kind of mirrors the national data, which is low back pain, neck pain, and shoulder pain are the three top areas that we tend to see the most. There are some newer areas that we're seeing. I am personally seeing a lot of neural entrapment, neural symptoms that people are having that are kind of unexplained and not often dealt well with, in the system. And then the other thing is, in these days, post hip replacement and especially post knee replacement, when people have already seen their physical therapist and physical therapy is now finished, but there are still soft tissue elements that need to be addressed. That's an up and coming thing in my own practice.
When I was in practice, I saw a lot of neck and shoulder pain, but I also would see low back pain. Those were the main conditions I worked with, but I would also work with pre and post surgical pain. And I could really see some difference after I applied my techniques for my patients.
I think one of the main things with massage therapy is time. We have a very intimate relationship with our patients in the table. We have time to listen to their stories. We hear the effects that they have over a much longer period of time because our sessions can be anywhere from 30 minutes to 60 minutes. And sometimes just having those small details that you may not get in a normal H&P or a pain evaluation form is vital to making sure that we have a true understanding of how their pain is truly affecting their life day in and day out. The other thing that I would say is that, massage therapy, research has proven that it does in fact reduce pain and it does improve their ability to perform activities of daily living, which is vital. We want them to have their independence. We want them to be able to enjoy time with their family and the things that make life worth living.
Massage therapy is a wonderful complement to other approaches, other integrative approaches to pain, whether acute or chronic, for many reasons. One, it can help to integrate other experiences in someone's body and in their pain experience as well. And then another thing that people sometimes don't think of is that massage therapy can indirectly impact pain in many other ways. So whether it's increase in self-efficacy or motivation to do other practices or other things that are going to be also beneficial for their pain is another area where massage therapy may be able to help in that whole treatment scheme.
It's really interesting the way massage therapy can complement other approaches. I lecture every year at the medical school, and one of the things that I teach is the role of soft tissue and how soft tissue can mimic other more serious conditions. I just saw somebody last week and who described a 20-year odyssey with her pain, and I asked her this question, which is, in all of that time, did anybody actually touch it? Did anybody actually physically and thoughtfully, thoroughly, carefully manipulate the soft tissue? And her answer was no. That's the role that we could fill in healthcare. Very precise, very thorough, very thoughtful palpation of soft tissue, which generally gets overlooked. I understand why. It takes time, it takes skill, but that's the role that we can fill, and it's a really important role. I've seen it overlooked way too many times over the years.
It's really interesting and sometimes it's funny. I've been working very closely here recently with an orthopedic surgeon who has a foot and ankle specialty. And he will often call me and say, hey, I've got this patient. The only other option I have is to go in and do exploratory surgery. I don't know how you do what you do, but I want you to take a stab at it. And most of the time, we're able to keep that patient out of having to have additional procedures. With those invasive therapies and operations, so there's a risk of infection and losing more mobility. And the reality is that if we can, keep them off the operating table or having those more invasive treatments, then it's better. It improves their life. We have a great network in our area of chiropractors and other pain specialists that are sending patients to our area. They understand that we understand research, that what we are doing is backed by research. We're getting positive results.
If I could tell patients or providers or prescribers one thing about massage therapy, is that you can't have a single expectation of an outcome for all the pain experiences. There's not one single measure that's going to be able to accurately assess the benefits, because it's going to be different for each individual, each situation, each pain experience. And so it's important to look to see what is most impactful and helpful for the patient. It may be that it's complete elimination of pain, which is great, but there's also some situations where pain isn't going to completely go away, but the pain management is impacted and improved. Or it could be that the pain is still there and maybe even at the same intensity, but someone's ability to cope and bear it and function with it changes. Their tolerance increases and improves. And there's not a single measure and assessment that can account for all those aspects of the pain experience. And then there's also all the other indirect impacts that it can have. So keeping that narrow focus on this one item might be a little too narrow. So just broadening that piece up and being willing to look at short-term and long-term pieces and those very acute and focused areas of impact, and then also those broader overarching quality of life type pieces.
So if we think about the role of massage therapy, is there evidence to show that massage therapy has a biological effect? The research is pretty positive in that direction, that there are things we can do that create real changes in the tissue. That's one aspect of pain. The second aspect of pain is psychological. There is some really wonderful research in the affective part of massage, the way massage affects someone's psychological being, and that's a really interesting area of research. And then, rather obviously, it's the social aspect. You are in a room with someone who has their complete and total focus on you and is listening and validating your experience, and that is not to be underestimated. And that is one of the most powerful aspects of massage and a really important piece of pain management.
Well, we know from the research that massage can help not only just general pain, but it can also help post-surgical pain and cancer pain. Those are from meta-analyses, which is our highest level of evidence. If I could tell patients and providers one thing about massage therapy, be that it works. It works. It helps for pain, all different types of pain. And if we could just try it and utilize it more often, more people could potentially be helped.